Welcome back. While the World Health Assembly, a United Nations body, set the general guidelines for human organ transplants, the 1991 guidelines emphasize that organs must be donated voluntarily and not for profit. Yet policing these guidelines is not an easy task. The illegal organ trade is often commonplace in countries deep in poverty. Again, cultural and social norms often dictate the availability of organs. For example, in India, only the first-degree relatives, that is, parents, siblings and children, can donate to an ill patient. Joining us again are our guests. In London, Nadi Hakim. He is a transplant surgeon at St. Mary's Hospital and the former president of the International College of Surgeons. In Vienna, Christina Kangas-Punta. She is the head of the United Nations Anti-Human Trafficking Unit. And on the phone from New Delhi, Sandeep Guleria. He is a professor from the Department of Surgical Disciplines at the All India Institute of Medical Sciences. Thank you very much indeed, gentlemen. We're talking about the need to implement reforms on organs transplant. And for this, let me ask Christina in Vienna, what do we have to do right at this moment? Take people to jail or implement new reforms that regulate the organ transplant?
Well, I think there are already regulations on the organ trafficking and the whole transplant issue. The problem which
it seems that they have no impact whatsoever, because by definition organs are not for sale, but everybody is selling his organs.
Yeah, exactly. But the problem is that this is not really implemented. So regulations by itself, they never solve any problems. It is exactly what is the action which is behind implementing these regulations. This is what is needed. And unfortunately, now we do not have this action in place. And this is, of course, the responsibility mainly by the governments, but it is also a responsibility by the consumers and those who are otherwise involved in this. In this whole business.
Mr. Nadi Hakim, the Transplant Association in London in the past has asked the government to ease restrictions. Are you in favor of this option?
I think I would agree with Christina, what she said earlier, but I would say that really the best way for the future, and we have no choice, is to regulate the trade. Whether we like it or not, people are going to go abroad and buy kidneys, but unfortunately we can't stop it 100%, and therefore we should be able to control it ourselves. The way, I have to say, is done in Iran, as you probably heard. They do a fantastic job. It's the government who is paying for those donors to donate, but they do it in a very controlled manner, which is a safe manner, and both donor and recipients do not suffer.
Mr. Sandeep, in Delhi, the temptations of money will be there and poor people will be there in India. Do you think a reform of the law should be implemented very soon?
No, I'm afraid I don't agree with Dr. Nadi Hakim. In fact, I would like to take him back to an article published by Zargushi, where he looked at the Iranian model and he studied the quality of life of donors from Iran. And in that article, it concluded that these donors were mainly from the most oppressed people in society. They had the highest suicide rates. A number of donors would disappear before surgery. And I don't think that in a civilized society, it is only one segment of society that has the right to live. I mean, even prostitution is illegal. It does continue. Human trafficking continues, but that doesn't mean we should try to regulate.
Dr. Hakim, how do you respond to that?
Yeah, I respond. I know the paper very well, and I know the author of the paper in Iran very well. It is true that the conclusion said that they do not live maybe a perfect life, but certainly the organ donation has been in a better shape than what we can see currently in your country, Dr. Sanjeev, and in Pakistan, etc. So whether you like it or not, I'm sorry, can I finish, please? Which means that, whether you like it or not, buying and selling is still flourishing in India and Pakistan and Egypt and the Philippines. So whether you like it or not, this is not going to stop tomorrow morning.
Okay, there are other hurdles to the issue of implementing the reforms, which is, in different countries you have conservatives and religious people who believe in the sanctity of the body and who are opposed to any forms of organ transplant. Christina, aren't you concerned that this is something that could be an obstacle to the implementation of global laws that would govern and regulate the organ transplant?
Well, we do have reached the consensus in other types of crime. We have consensus by all our member states on trafficking in persons. This doesn't include trafficking in organs. It includes trafficking in persons for the organ removal. So in partly it is already covered, and this consensus is already there. If there is a crime, if there is a human suffering, I think everything must be done in order to stop it.
So Sandeep, what do you suggest should be done in India right now?
We're trying to push very hard a cadaveric organ donation program. We also... hello?
Go ahead, go ahead.
Yeah, we also do have, we are also looking at now at ways that we can strengthen our organ retrieval system so that more and more cadaveric donors do come forward. You must remember that even if we are able to harvest half of all our road traffic accidents, we will be able to meet our requirements for organs.
Okay.
And I think the
Mr. Hakim,
government will look...
Mr. Hakim, Sandeep is raising the issue of cadaveric transplant as an alternative. Will it be the best solve to this issue?
Certainly not enough. You know, in the UK, that's what we've been doing, using cadaveric donors for many, many years in the past. And we only now started doing more than 50% of our recipients are getting kidneys from live donors. And in other words, we should push for both. And I know what Sandeep just said, because, you know, only recently cadaveric donation has started to be implemented in India, but organ donation of cadaveric donors have been going on for many, many years in Western Europe.
So it seems that now, without implementing new laws, we will be just entering uncharted terrain. Everything will be just ambiguous, the same as we have now a very grey area, which helped Amit Kumar and many others just to start performing these operations. I can't see any clear answer to this issue, Christina.
Yes, actually, what many of our member states, specifically in certain regions, what they are asking us to do is to start the negotiations on a new convention which is specifically focusing on the organ trafficking. It is seen a problem, and it is seen that there must be a global solution for that, which is connecting all the member states and also other partners to find a solution. So hopefully we can enter this kind of discussions very soon so that we could have globally binding regulations.
Mr. Hakim, shall we consider organ bodies as other public commodities in demand and supply?
Well, whether you like it or not, or we like it or not, we need the organs, and people will be there to offer their organs. Ideally, what we should be looking for is donating our organs, especially the kidney when we're alive, to our loved ones, to our friends. What goes on in Asia, as you mentioned earlier, is something which is not a good thing. But I think what we need to do is get our organs from our own population. In other words, the British should get their organ from the UK citizens, the French from the French, and not allow patients from the Gulf, for instance, Gulf states, to go to the Philippines, India, etc., to make it a market for those countries where they make a fortune out of your countrymen. And this is what should be stopped.
Mr. Nadia Hakim in London, Ms. Christina Kangas-Punta in Vienna, and Mr. Sandeep Guleria in Delhi, thank you very much indeed for contribution. Thank you so much for joining us here on this edition of Inside Story. We welcome your comments and suggestions. Please email them to us at insidestory@aljazeera.net. Goodbye for now.